software, and that includes a control panel on the right-hand side, and we have some items there to make things go easier and to facilitate some discussion through this process. So you'll see on the right-hand side the control panel. The first option is to collapse and expand that panel because sometimes it does block the slideshow that we have to show you the information. Below that is the option to raise your hand to request that we unmute you. Everyone is automatically muted from the beginning just so we don't have feedback, background noise. But you can raise your hand, we'll unmute you, and you can ask a question. There is also the chat box at the bottom where you can submit a question or a comment. I'll be checking through that, and we have a second person on just to be viewing that to make sure that we get those questions, and we might be able to, depending upon what they are, we'll squeeze them in or we'll address them at the end. Okay. Next up, you're going to see this placeholder questions slide. We do use this slide when we are taking the opportunity to ask all of you, our audience, a question. A box will appear on your screen, and you will be able to answer the question by selecting one of the choices. We will have 2 knowledge questions later in the presentation, but at this time, we're going to ask a few questions just to get a better understanding of our audience. So I'm going to run through those 4 questions now. So you will see them up here on your screen. The first question is, what is your current professional role? And on my side, I get to see when people have answered, so I'll just give it a second. Okay. So you can get a picture as far as our audience as well. Next up, we have, what field do you represent? Okay. Our third question, do you conduct SBIRT interventions? And the last question for our audience at this time, do you see your agency using SBIRT? Great, thank you so much for your participation. Okay, now I'm going to take a moment to introduce the presenters, and then I will turn things over to them. Dr. Condon is a research professor at the Center on Alcoholism, Substance Abuse, and Addictions. He's trained as a neuroscientist, and he has over 30 years of experience in the substance abuse and addiction research field. Dr. Harris is a project evaluator of the federally funded New York State SBIRT Cooperative Agreement, which delivers SBIRT in STD clinics, tuberculosis centers, CHEST centers, emergency departments, and a federally qualified health center. So at this point, I'm going to turn things over to Dr. Condon to speak.
Well, good morning. Thank you, Danielle. Well, good morning to everyone. Thank you for joining us for really the initiation of a very important project that we're starting here in New Mexico. I first want to thank the National Screening, Brief Intervention, and Referral to Treatment, ATTC, located at Areta, because they are, in fact, dedicated to training and doing technical assistance related to SBIRT. And they've been a valuable partner as we start these first training. So we go to the next slide. So the New Mexico School-Based Health Center project has several partners, which it wouldn't be possible without these partners. And of course, the main partner is the New Mexico Department of Health School-Based Health Center program located within the Office of School and Adolescent Health at the Department of Health. And that, of course, is directed by Yolanda Cordova, who's actually been a terrific partner right from the beginning when we first started talking about this project. The University of New Mexico Center for Alcoholism, Substance Use and Addiction, CASAA, where I work, is just celebrating its 25th year of doing high-quality research on treatment and prevention and disseminating it to the public. So we have a long history. Our very important partner is Envisions New Mexico, which is actually one of the divisions or one of the sections of the UNM Department of Pediatrics. They actually run a number of school-based health centers. They do quality improvement. They do technical assistance in telehealth to school-based health centers around the state. And they're really been spearheading this effort. And I would be remiss if I didn't thank our funders. All of this has become possible to do this initiative in New Mexico because we were awarded a grant from the Conrad and Hilton Foundation, who's one of the only foundations that is actually focusing on substance abuse issues, and they're very focused on substance abuse issues related to youth across the country. And so we received a 3-year grant from them to conduct this initiative. Next. So why do we need to do this? Well, it's probably obvious to most of you, and especially to those of you who are providers at school-based health centers. Adolescent substance abuse is recognized as a major health priority here in New Mexico. New Mexico Department of Health will adopt a full SBIRT model as a standard and benchmark beginning in 2015. So that's why we're starting this initiative now. And by the end of our 3-year period, the Department of Health expects this to be a standard and benchmark for all school-based health centers. This collaborative effort between the agencies proposes to improve adolescent substance abuse care provided through the New Mexico Department of Health school-based health programs. Next. Well, why is this important? Well, you all know this probably from your practices, but this is data from the Center for Disease Control. And as you can see, New Mexico's data is in red, and U.S. average data is in blue. The number of, the percentage of young people who've used alcohol before the age of 13 is significantly higher than the U.S. average, 22.3%. And that's before the age of 13. That's not probably a surprise to many of you who are school-based health providers, but it is a higher than average number. We have a serious alcohol problem in the state, as you all know, and we really hope that we can do something about that. If you look at the marijuana numbers, before the age of 13, we're twice the national average, more than twice the national average in terms of marijuana use before the age of 13. The same thing is through with ever using cocaine for students, high school students. Ecstasy is higher. Heroin use, ever having used heroin, is higher than national average, and I expect this is actually going to continue to rise with our prescription drug opiate epidemic that we have here in New Mexico. And methamphetamine use, ever used, is of course also higher than the national standard. So we unfortunately rank higher on the youth substance abuse scale than we would like. Next slide. Substance use increases risky behavior. Well, that's not a surprise to most of you. It does in adults, but it especially does in adolescents, who, as we now know, their brains are not fully developed until the early 20s. So our adolescent substance use users are more likely to be sexually active, engage in risky sexual behavior, become pregnant, and contract STDs, sexually transmitted diseases. Next. Risky sexual behaviors during last sexual intercourse among New Mexico adolescents, and again, and this is from the Youth Risk Behavior Survey from the Centers for Disease Control. And as you can see, 19.1% drank alcohol or used drugs during their last sexual encounter. Disturbingly, 42% did not use a condom, 84% did not use birth control pills, and 13.8% did not use any form of contraception. So these are risky sexual behaviors, and a lot of these, as you can see, almost 20%, are also associated with alcohol and drug use, which impairs judgment. Next. Substance use increases unintentional injuries and fatalities as well. Major contributors to the leading cause of death among adolescents: motor vehicle accidents, homicides, and suicides. Every first-time use, even every first-time use, increases the risk of unintentional injury or death. So, for example, 68% of the emergency department visits by 12 to 14-year-olds involved the use of alcohol or drugs in 2008. That's the last year we have this data for. 31% of 15 to 20-year-olds involved in fatal crashes in 2008 had been drinking, and that's a tragedy that we can actually do something about. Next slide. Substance use in school. Well, for our teachers, it's not a surprise that adolescent substance users are twice as likely to have poor grades and drop out of high school. If you think about it, we know that marijuana, since we have quite a problem in this state with marijuana, smoking marijuana all weekend, which affects short-term memory and learning. Most of our students are not, who are doing that, are not learning very much on Monday and Tuesday during the week. They're more likely to get into fights as well, and substance use is also associated with other school misconduct and lack of effort and interest. And we also have health concerns. Substance abuse by adolescents increases the risk of liver disease, stroke and cancer, headaches, eczema, irritable bowel syndrome, peptic ulcers, asthma, sinusitis, and sleep disorders. And of course, because of risky sexual behavior, it also can increase HIV and sexually transmitted diseases. And we also have a large problem with alcohol poisoning and overdose. So what is binge drinking? You've heard a lot about binge drinking on college campuses, but we in fact have a lot of binge drinking in our high schools as well. So the National Institute of Alcoholism and Alcohol Abuse defines binge drinking for men, adult men, as 5 or more drinks. For women and men older than 65 is 4 or more drinks, and that's all within a 2-hour span. If you look at what the national data on youth binge drinking looks like, youth age 9 to 3, it's 3 or more drinks within a 2-hour period. For girls ages 14 to 17, it's 3 or more drinks during that 2-hour period. Boys, it's 4 or more drinks, 14 to 15-year-old. And then when boys age to 16 to 17, 5 or more drinks is considered binge drinking, same as the adult males. Next slide. And we wouldn't be complete unless we talked about the intersection of substance abuse and other behavioral health problems, adolescence and depression. 26.9% reported symptoms of depression in the last 12 months compared to 40% of current drinkers reported symptoms of depression. 43.4% of youth reported symptoms of depression if they were binge drinkers, and 37.7% of current marijuana users reported symptoms of depression. 18.6% of binge drinkers actually attempted suicide during the past 12 months. That's a very sad state of affairs. Next slide. The long-term effects, well, we know that a lot about that related to adults, but early initiation of alcohol increases the likelihood of future dependence, and that's why preventing and slowing and even stopping the use of drugs early in adolescence is a winner across the board. So if you look at this data, 47% who started drinking before the age of 14, almost half develop an alcohol use disorder in their lifetime, compared to 9% of those who started drinking after 21. This is the longer we can keep our young people abstinent from using drugs, the less likely they are going to develop a substance use disorder in adulthood. And in addition, because the brain is still developing in our young people, cognitive functioning of the brain can be permanently impaired even if the adolescent stops using drugs. So the next slide, I think, is going to be a quiz. Adolescent substance use is associated with which of the following? Yay! So everybody's paying attention. That's a great response. And so at this point, thank you for your attention, and I'll be back a little bit later in the webinar, but I'm going to turn it over to Dr. Brett Harris, who I've had the pleasure of working with on this project.
Thank you, Dr. Condon. Okay, so I'm going to describe basically what SBIRT is and how we're going to use it to address all of the issues that Dr. Condon was talking about, so the high rates of substance use and all of the negative consequences. So SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. So screening is using a standardized screening tool, which we'll describe more on Thursday, but it uses the universal screen, you know, in either interview or self-administered format to identify students along a spectrum of substance use. So we're not looking to find those students with substance use disorders and refer them into treatment, but we're looking to screen every single student and see where they lie. So you want to screen the students who have not yet initiated use, as well as the ones that might be using recreationally, as well as those ones that are abusing substances. And based on their screening score, you provide either, you know, brief advice if the student is, you know, may not be using at all, provide positive encouragement, and you know, identify them along, you know, spectrum of use. So if they're risky users, providing a brief intervention immediately on site using motivational interviewing techniques and trying to motivate them to make a change and develop a plan to do so as they direct it themselves. And then referral to treatment for those who are abusing or showing signs of dependence. So how does SBIRT address student need? In a number of ways, and we're going to go over them one by one, but basically it reduces alcohol and marijuana use. It helps prevent initiation of substance use. Because of the prevention aspect of SBIRT, it can help to save your organization money. Providing SBIRT in a school-based health center provides the convenience of a school setting with the confidentiality of a medical setting. It's a very good fit for adolescents because they are in that stage where they want to be autonomous and they don't want to do. And also, studies have shown that it's not all of this commended by the Medical Association. Just going into a little bit more depth about what I just mentioned to you in the previous slide, that research has shown changes in adolescent attitudes as a result of SBIRT. So studies have found that based on the brief intervention portion, that they have shown greater readiness to change their behavior, increases in self-efficacy for making changes. They've decreased intentions to use, as well as they don't perceive that all of their friends are using substance use like they did before. So usually, adolescents feel like everyone's using and they have to use to fit in, but in reality, not all of their peers are using, and it helps them to understand that they don't need to use because not all of their friends are using or not all of their peers are using. Research has shown it also prevents initiation and reduces use. So one study, actually a pretty large study in New England, found that lowered past 90-day alcohol use and other drugs for the group that got SBIRT versus the usual care group. Other study has found that, actually skipping to the third bullet, which was the same study, it assessed those who had not yet began drinking, and it found reduced initiation. So 44% fewer adolescents had started drinking over a 12-month period compared to those receiving usual care. And other studies have found decreased marijuana use after 3 months, and as well as reduced risk of drinking and driving. Now, to touch upon the organizational cost savings, SBIRT is one of the services ranked by the U.S. Preventive Services Task Force, and it's ranked actually among the top 5 most beneficial and cost-effective preventive health services. And to give you a comparison, it's actually been ranked higher than screening for high blood pressure, high cholesterol, breast, colon, or cervical cancer, and osteoporosis. So actually the measurement is that for every dollar spent on substance use early intervention, $4.3 is saved. Now, we're focusing here on school-based health centers, not only for the convenience of it being located in schools, but also the confidentiality that is provided in a medical setting. So, as I said, research has shown that students are willing to discuss substance use with a knowledgeable healthcare provider, and as you are yourselves and located in a school-based health center, it helps to bring the discussion of substance use into healthcare, and the students report not feeling judged among school-based health center providers. And just to touch upon the fit for adolescents, so this is not a typical, being told not to use, to stop using completely, and that it's wrong, and that they can get in trouble for doing it. This is a self-guided intervention. So the adolescent does not have to force or not have to admit that they're having a problem. That's not the purpose of it. At this stage, adolescents desire autonomy, and they often resist authority. So, as you know, some people, some authorities fear telling students what to do because they feel that they just go ahead and do it for that reason. So instead, this intervention allows adolescents to develop action-oriented goals while avoiding confrontation. Now, adolescents have reported satisfaction with SBIRT. They've rated the provider advice as excellent or very good. They were very satisfied with the services they received and reported that they were very likely to follow through with the advice. Now, as I said before, this service is recommended by the American Academy of Pediatrics and the American Medical Association. Their actual recommendation is that pediatricians and other healthcare providers who work with children and adolescents conduct routine substance use screening and brief interventions using motivational interviewing techniques, and that they become familiar with a network of treatment providers should an outside referral be necessary. All right, here's the second question in the quiz. Which of the following is not a way in which SBIRT in school-based health centers addresses student substance use? Okay, so the answer is that it does not require them to discuss their use with their parents. So most of you got the answer correct, and which I'm pleased about. But whereas parents may be brought into this at a the point of referral to treatment, the confidentiality in the school-based health center does not require them to discuss their use with their parents, which may make them more open to sharing their substance use with the provider. Okay, we're just going to go briefly into the SBIRT protocol for the New Mexico DOH school-based health centers. So the screening instrument that is going to be used is the CRAFT. We'll talk more about that on Thursday. And the CHISPA is going to be used to guide the brief assessment. The brief intervention will include motivational interviewing, which you will have additional training on in the coming week, next week. And we'll also be providing referrals to treatment. So all school-based health center providers, so you guys viewing this webinar will receive SBIRT trainings and motivational interviewing trainings. So this is the first of those trainings. Trainings on local and state referral sources, and you'll be provided with electronic tools to support SBIRT practice. And as I said, it will be an SBIRT 101 on Thursday, so we'll give you more details on the protocol. So you might be thinking, we already do this, or we already do some of this SBIRT. So just to bring it to that point, what is SBIRT versus current practice? So you may be delivering some of the components of the model, but providing screening using the standardized tool, as well as the providing the services based on the screening score, and the brief intervention using motivational interviewing and the referral to treatment, putting those all in combination is our goal with this project. And when providing all of these in combination, we're providing the SBIRT model. So at this point, I'm going to hand this over to Dr. Condon.
Thank you, Dr. Harris. One of the things that I'd like to talk about is the case for SBIRT in New Mexico school-based health centers. New Mexico school-based health centers are already provide an integration of primary care and behavioral health. The New Mexico Department of Health School-Based Health Center uses the CRAFT, which is a validated evidence-based screening tool developed for adolescents as part of its standardized student health questionnaire. This is, by design. The Department of Health and Dr. Mary Ramos, who you'll hear from on Thursday, actually, when they were developing the school-based health questionnaire, embedded this screening tool for substance abuse into that questionnaire, so that is already a part of the system. And of course, all school-based Department of Health school-based health centers should be using the school health questionnaire. Now, one of the data from the 2002-2013 provider survey indicated that only 38% of school-based health centers actually use and have used a positive CRAFT screen. They actually know what to do with a positive CRAFT screen. And you'll learn more about the CRAFT, how to use it later on Thursday. Next slide. Oh, let's go back one, Danielle. Yes. The point on the second bullet is the actual data from the survey, a pilot study, was not 38% of the school-based health centers use it, but in fact, 38% of school-based health center students who actually use the centers have, in the 2012 to 2013, have had a positive CRAFT screen. That's almost 40% of the students who come into the school-based health center have a positive screen for substance use. That's a very large number, and I think it's something we could do something about. Next slide. However, what we've also found out from the New Mexico Department of Health provider survey is that most school-based health centers providers do not score the CRAFT screens correctly. We also know that most do not know how to do an assessment, and most do not do a brief intervention for substance use concerns after a positive screen. And these are all things that we intend over the next few months of training and coaching is to help you all understand and implement the SBIRT program. Next slide. The SBIRT model actually was piloted in New Mexico school-based health programs by the Department of Health in 2 high schools in 2013 and 2014. And the preliminary data from the pilot was that providers trained in screening, brief intervention, motivational interviewing, and referral to treatment. The brief assessment tool, you'll hear more about the CHISPA. This is literally an assessment tool that's been created by the team partners who are actually working on this. And it created a standardized assessment following a CRAFT screen. So a CRAFT screen gives you a positive or negative signal, but it doesn't always give you more information about what to do about that. The person is a person using alcohol, the person using heroin. Obviously, those are different circumstances, and they need different kinds of remedial applications. Strongly, quotes from the providers were strongly positive feedback. One quote was that it takes a little longer, a little more time, but actually the assessment shows me now what I have to do. Next slide. Benefits of standardized tools. Providers of evidence-based algorithms for provision appropriate for services for the CRAFT, so it's evidence-based. Taking the guessing game on identifying problems for substance use. Using a standardized screening tool results in a higher detection of problem substance abuse. and is in fact a best practice. And we're hoping that the use of the New Mexico CHISPA brief assessment tool will be a big boost that will provide additional information for providers so that they know exactly what course of action needs to happen for this young person. Next slide. I think just turn this back over to Dr. Harris.
Thank you, Dr. Condon. So just to wrap up, put it all together, the last few slides we discussed. So substance use services are being provided. So we saw that 38% of students in school-based health centers are screening positive, but the SBIRT model components are not all being conducted. And once again, that's why we're here. And we know that providing the standardized SBIRT protocol may make you guys more effective at helping students reduce their substance use. So in the end, that we can help address the high rates of use compared to the national average, as well as those negative consequences that may result. So a survey was conducted with New Mexico Department of Health School-Based Health Center providers, and there were barriers that were identified to discussing, treating, and referring students to substance abuse treatment. The number one reported barriers were not knowing where to refer students for treatment. That was 73%. Another, almost 60% reported confidentiality concerns regarding parents. Almost half reported time constraints. 41% reported a lack of a clinical algorithm. So here we are on Thursday. We'll tell you more about this algorithm of how to use the CRAFT instrument as well as the CHISPA to identify what services to provide and how intense the services should be. A lack of an assessment tool was also reported, so we'll introduce the CHISPA on Thursday. And then also lack of experience. So providing support through this project, we will help you to gain that experience. Other challenges are a lack of training in substance use topics in general, not just SBIRT. Also, there are differences based on geography. So, for example, Albuquerque versus the rest of the state. So knowledge, attitudes, perceptions, and resources may be different based on geography, and we'll have to address those and target the school-based health centers in different parts of the state with tailored efforts. So throughout this process, you will be supported in implementation, and I'm going to go over in the next few slides and describe those supports for you. So one of them is administration. So we'll ensure that you guys gain the skills required to conduct SBIRT. So we have developed data systems to support implementation and evaluation. The CHISPA brief assessment tool has been developed specifically for this project. And also there will be SBIRT and electronic tools that will include the CRAFT and the CHISPA, and this will be a priority for the project. In terms of implementation teams and champions, we highly recommend having these systems in place. So the New Mexico Department of Health is working with Envision and CASAA at the University of New Mexico, as described earlier. This has helped to define the implementation strategy. SBIRT for this project has been designed specifically so that it can be integrated into your existing system. We've also selected the screening instrument and electronic tools, as mentioned in the last slide, to support SBIRT. And for you guys to consider, it's very important for each of your organizations to identify a champion to support SBIRT. Now, we're making sure that you guys have the skills and the experience to be able to conduct the SBIRT with confidence. So this presentation is the introduction to this project. And on Thursday, we're going to provide a brief SBIRT 101 training, which is going to introduce the clinical skills. And then there will also be a motivational interviewing training to give you some techniques and tools to conduct the brief intervention portion of SBIRT. Now, I just want to stress that it's important that these skills be practiced and mastered on the job with the help of a coach. So it's very important to identify someone in your school-based health center to serve as the coach. And this coach should develop expertise in SBIRT and motivational interviewing, so that any issues come up, questions, or just needing a brief booster, and to hone your skills in the brief and the screening and the brief intervention, that this coach can help provide that service at any time. It's also very important to be aware of the treatment providers in your area. And that was a major barrier reported by the New Mexico School-Based Health Center providers, not knowing where to refer students to treatment. So it's really important to meet with substance use treatment agencies in your area, and that is one of the activities planned at the beginning of this project. This will help you to understand referral requirements, as well as to identify contacts at the treatment program that you can ask questions and get consultation. The evaluation is a key part of this project, and it's very important to conduct regular process evaluation using the data that you have available. Because, of course, I mean, the SBIRT protocol has been developed to fit into your workflow. It's also pretty certain that there will have to be changes made mid-course to this. So not you and all the frontline staff should be involved in discussions about implementation and any changes that are going to be made, as it does affect everybody in the school-based health center. Now, to bring up again the support of the National SBIRT ATTC, so IRETA is supporting this initiative, helping to provide the training as well as giving ongoing consultation. And IRETA has expertise in implementing SBIRT successfully and will continue to support the project. So here are a list of references from the research cited earlier, so for your reference. And now we're going to open this up to questions.
Okay, so one of the questions that's present just as far as logistically is, for the slides and the recording of this webinar, will they be available after the webinar? And yes, they will. You'll get an email with that information. Wait just a second. I'm going to take this back. So we will send that information out to you by email. You'll receive that as soon as I get that compiled. Okay, and I've just put the contact information for everyone up on the screen so that we can see that. Let's see what else we have here. Deborah asked, how long does it take to become proficient in MI and SBIRT?
Well, we're going to provide about an hour webinar on Thursday on the clinical protocol for SBIRT. So this is, it's really just going to be an introduction. And then a more in-depth motivational interviewing training will be provided. But we suggest that skills need to be practiced. So following learning all of the the protocol and skills to do some role playing within your with your team and your organization. So really we suggest doing at least 4 hours worth of training, and including and then also including role playing. But of course you will need. It really does help to have continued practice. So not after that 4 hours or the 6 hours, whatever is completed, to continue honing your skills with your colleagues.
So this is Tim Condon. So what we envision and have lined up for our school-based health center providers is MI training, equivalent of about a full day, And after that, there'll be the typical MI fidelity check. You will have 2 MI trainers who will actually be available for coaching you. We envision you taping some of the sessions that you do motivational interviewing, and those tapes will be coded and scored, and your coach will then be able to give you feedback about how you're doing. Are you doing it right? Are you having more emphasis on one thing or another? And we're planning on 1 coaching session each month for 3 months. So that will give you a really good basis and a good start on your motivational interviewing career. And of course, I want to stress that we're very much interested in training both the primary care providers as well as the behavioral health providers in this truly integrated system of school-based health centers.
At this time, there aren't any other questions here, but people can feel free to put them in the chat box or the question box. There is a little bit of discussion just as far as the original questions we asked about the different types of roles, and Ray mentions that he's an SBIRT network coordinator in North Carolina. So we certainly reached beyond New Mexico today. Just waiting to see if any additional questions come in, if there's any other comments, Dr. Condon or Dr. Harris.
Well, I just want to thank again the National Screening Brief Intervention Referral to Treatment, ATTC. Worked with the ATTCs for almost 30 years, and they're a wonderful resource for addiction technology transfer. So they take the science and transfer it to the field. It's a resource that you should use as much as you can as we move forward with this project. And thank you again for all participating in this great initiative as we move forward and try to help the youth with substance abuse in New Mexico.
All right, and I'll let everyone know you will receive just a few emails from us. One will include the PowerPoints so that you can reference those, and then when we get the recording up, you'll get an email about that as well so that you can access the recording and pass that along. It's a public link. So if you have anyone you'd like to forward that to. Additionally, there is a group I know that is dealing specifically in New Mexico with this group, so you might have additional communication coming out about that. But I appreciate everyone joining us today, and let us know if you have any questions. Additionally, to this contact information here, you can always email info@ireta.org, and we can get back to you. All right. Okay, it looks like some individuals are leaving, so I'll stop the recording now and let us know if you have additional questions. Thank you.